What is melanoma skin cancer? Main symptoms of melanoma skin cancer. A new mole or a change in an existing mole may be signs of melanoma. Melanomas can appear anywhere on your body, but they're more common in areas that are often exposed to the sun. Some rarer types can affect the eyes, soles of the feet, palms of the hands, or genitals. Check your skin for any unusual changes. Use a mirror or ask a partner or friend to check any areas you cannot see. Mole with an uneven shape or edges. Close-up of a melanoma on a person with white skin. There is an unevenly shaped light brown patch on the skin, with darker brown areas in the middle. Credit. DRP, Marazzi/Science Photo Library https://www.sciencephoto.com/media/108472/view. Normal moles are usually round with smooth edges. Melanomas are often an uneven shape. They may have two different shaped halves and uneven edges. Mole with a mix of colors. Close-up of a multicolored melanoma on white skin. The melanoma is a mix of brown and black. Credit. DRP, Marazzi/Science Photo Library https://www.sciencephoto.com/media/253324/view. Normal moles are usually only one color. Melanomas are often a mix of two or more colors. Large mole. A large brown, irregular-shaped melanoma on a person's left cheek, close to their nose. Shown as on white skin. Credit. BSIP, Gerand/Science Photo Library, https://www.sciencephoto.com/media/10354442/view. Normal moles are usually small. Melanomas tend to be bigger, often more than 6 mm wide. Mole that changes over time. Normal moles usually do not change over time. A mole that changes size, shape, or color may be a melanoma. Other signs to look out for include moles that are swollen and sore, bleeding, itchy, crusty. Close-up of a melanoma on white skin. The melanoma is red and swollen, with crusty brown and black areas. Credit. DRP, Marazzi/Science Photo Library https://www.sciencephoto.com/media/97260/view. Non-urgent advice, see a GP if you have a mole that's changed size, shape, or color. You have a mole that's painful or itchy. You have a mole that's inflamed, bleeding, or crusty. You have a new or unusual mark on your skin that has not gone away after a few weeks. You have a dark area under a nail that has not been caused by an injury. Finding a melanoma as early as possible can mean it's easier to treat. What happens at the GP appointment? You will be asked some questions about your health, family medical history, medical conditions, and your symptoms. Tell the GP if you have a mole, freckle, or other area of skin that's recently changed. Also tell them if you or a member of your family have had skin cancer in the past. The GP will look at your mole and any other areas of affected skin. They may ask you if they can take a photograph of it to send to a specialist, dermatologist, to look at. This is called teledermatology. Referral to a specialist. The GP may refer you to a specialist in hospital for more tests if they think you have a condition that needs to be investigated. This may be an urgent referral, usually within 2 weeks, if you have certain symptoms. This does not definitely mean you have cancer. Information. Find out more. Cancer Research UK, seeing your GP with a possible melanoma. Melanoma focus, teledermatology. Main causes of melanoma skin cancer. Ultraviolet, UV, light is the most common cause of melanoma. It comes from the sun and is used in sunbeds. Melanoma is more common in older people, but younger people can also get it. You're also more likely to get melanoma if you have pale skin that burns easily in the sun, red or blonde hair, blue or green eyes, a large number of freckles or moles, had a lot of sun exposure and you've had sunburn a lot in the past, used sunbeds a lot, a history of skin cancer in your family or you've had skin cancer before. If you have black or brown skin, you have a lower chance of getting melanoma, but you can still get it. People with black or brown skin most often get melanoma on the soles of the feet, palms of the hands, or under a nail. Main test for melanoma, excision biopsy. If a GP refers you to a specialist, dermatologist, because they think you could have skin cancer, you'll have tests to check for melanoma. The specialist will check your skin and ask you about any changes you've noticed. They may use a magnifying device that lets them look at the skin more closely. The specialist may also cut out the mole and a small area of surrounding skin so it can be sent to a lab and checked for cancer. This is known as an excision biopsy. Getting your results. You should get the results of the excision biopsy within 2 weeks. They will be sent to the GP or the hospital where you had the procedure. Try not to worry if your results are taking longer than you expect. It does not mean anything is wrong. You can call the hospital or GP if you're worried. They should be able to update you. A specialist will explain what the results mean and what will happen next. You may want to bring someone with you for support. If you're told you have melanoma skin cancer. Being told you have melanoma skin cancer can feel overwhelming. You may be feeling anxious about what will happen next. It can help to bring someone with you to any appointments you have. A group of specialists will look after you throughout your diagnosis, during and after treatment. Your team will include a clinical nurse specialist who will be your main point of contact during and after treatment. You can ask them any questions you have. Next steps. If you have been told you have melanoma skin cancer, you'll usually need some more tests, which may include a CT scan or an MRI scan. Tests to see if the melanoma has spread to your lymph nodes. Blood tests. The results of these tests will show how deep the cancer is and how far it's spread, called the stage. This will help your specialist decide what treatment you need. Treatment for melanoma skin cancer. Melanoma skin cancer can often be treated. The treatment you have will depend on where the cancer is, if it has spread, your general health. Surgery is the main treatment for melanoma. Radiotherapy, medicines, and chemotherapy are also sometimes used. The specialist care team looking after you will explain the treatments, benefits, and side effects. Work with you to create a treatment plan that's best for you. Discuss the chances of the melanoma coming back and how it will be treated if it does. You'll have regular checkups during and after any treatments. Depending on the stage of your melanoma, you may have tests and scans. If you have any symptoms or side effects you're worried about, talk to your specialists. You do not need to wait for your next checkup. Surgery. Surgery is the main treatment for melanoma, especially if it's found early. You may also need surgery if the melanoma has spread to other areas of your body or if it has come back again after being removed. Several types of surgery can be used to treat melanoma. For example, you may have surgery to remove the melanoma and an area of healthy skin around it. This helps lower the chances of it coming back. Swollen lymph glands, part of the body's immune system, if the cancer has spread to them. Melanoma that spread to other areas of your body. If the melanoma is in a visible area, such as on your face, a plastic surgeon may carry out the surgery to make sure the end result looks as good as possible. If a large area of skin is removed, skin may need to be taken from another part of your body and used to cover the area where the melanoma was. This is known as a skin graft. Radiotherapy. Radiotherapy is sometimes used to reduce the size of large melanomas and help control and relieve your symptoms. You may have one or several sessions of radiotherapy. The amount needed depends on the area of your body being treated and if you're also having other types of treatment. Targeted medicines and immunotherapy. Targeted medicines aim to stop the cancer growing. Immunotherapy medicines help your immune system find and kill the cancer cells. Targeted medicines or immunotherapy are sometimes used to treat melanomas that cannot be treated with surgery, have spread to nearby lymph glands, have spread to other areas of the body. A sample of the melanoma is usually tested before having targeted medicines. This is to check for changes in certain genes and help doctors decide if this type of treatment is likely to work. Chemotherapy. Chemotherapy uses medicines to kill cancer cells. It's sometimes used to treat advanced melanoma, where it's spread to another part of the body. Chemotherapy does not work as well for melanoma as other treatments like targeted medicines and immunotherapy. But it might be used if you're unable to have other treatments. What happens if you've been told your cancer cannot be cured? If you've been diagnosed with advanced melanoma, it might be very hard to treat. It may not be possible to cure the cancer. In this situation, the aim of your treatment will be to limit the cancer and its symptoms, and help you live longer. Finding out the cancer cannot be cured can be very hard news to take in. You'll be referred to a special team of doctors and nurses called the palliative care team or symptom control team. They'll work with you to help manage your symptoms and make you feel more comfortable. The clinical nurse specialist or palliative care team can also help you and your loved ones get any support you need. Treatment. Melanoma skin cancer. Treatment for melanoma skin cancer. Melanoma skin cancer can often be treated. The treatment you have will depend on where the cancer is, if it has spread, your general health. Surgery is the main treatment for melanoma. Radiotherapy, medicines, and chemotherapy are also sometimes used. The specialist care team looking after you will explain the treatments, benefits, and side effects. Work with you to create a treatment plan that's best for you. Discuss the chances of the melanoma coming back and how it will be treated if it does. You'll have regular checkups during and after any treatments. Depending on the stage of your melanoma, you may have tests and scans. If you have any symptoms or side effects you're worried about, talk to your specialists. You do not need to wait for your next checkup. Surgery. Surgery is the main treatment for melanoma, especially if it's found early. You may also need surgery if the melanoma has spread to other areas of your body or if it has come back again after being removed. Several types of surgery can be used to treat melanoma. For example, you may have surgery to remove the melanoma and an area of healthy skin around it. This helps lower the chances of it coming back. Swollen lymph glands, part of the body's immune system, if the cancer has spread to them. Melanoma that spread to other areas of your body. If the melanoma is in a visible area, such as on your face, a plastic surgeon may carry out the surgery to make sure the end result looks as good as possible. If a large area of skin is removed, skin may need to be taken from another part of your body and used to cover the area where the melanoma was. This is known as a skin graft. Radiotherapy. Radiotherapy is sometimes used to reduce the size of large melanomas and help control and relieve your symptoms. You may have one or several sessions of radiotherapy. The amount needed depends on the area of your body being treated and if you're also having other types of treatment. Targeted medicines and immunotherapy. Targeted medicines aim to stop the cancer growing. Immunotherapy medicines help your immune system find and kill the cancer cells. Targeted medicines or immunotherapy are sometimes used to treat melanomas that cannot be treated with surgery, have spread to nearby lymph glands, have spread to other areas of the body. A sample of the melanoma is usually tested before having targeted medicines. This is to check for changes in certain genes and help doctors decide if this type of treatment is likely to work. Chemotherapy. Chemotherapy uses medicines to kill cancer cells. It's sometimes used to treat advanced melanoma, where it's spread to another part of the body. Chemotherapy does not work as well for melanoma as other treatments like targeted medicines and immunotherapy. But it might be used if you're unable to have other treatments. What happens if you've been told your cancer cannot be cured? If you've been diagnosed with advanced melanoma, it might be very hard to treat. It may not be possible to cure the cancer. In this situation, the aim of your treatment will be to limit the cancer and its symptoms, and help you live longer. Finding out the cancer cannot be cured can be very hard news to take in. You'll be referred to a special team of doctors and nurses called the palliative care team or symptom control team. They'll work with you to help manage your symptoms and make you feel more comfortable. The clinical nurse specialist or palliative care team can also help you and your loved ones get any support you need. Surgery for melanoma. Surgery for melanoma. Surgery is the main treatment for melanoma. You might have surgery to remove an early-stage melanoma, the lymph nodes close to the melanoma if the cancer has spread there. Melanoma that has come back in the same place following an operation. Melanoma that has spread to other parts of the body. Surgery to remove more tissue, wide local excision. Doctors diagnose melanoma by removing the abnormal mole or area of skin. They send it to the laboratory to check if it's a melanoma and how thick it is. It's likely you'll have a second operation to remove more tissue if you're diagnosed with melanoma. This is called a wide local excision. Your doctor removes a larger area of healthy skin and tissue from around where the melanoma was. This helps to reduce the risk of the melanoma coming back. How much tissue you have removed depends on whether melanoma cells are in the surrounding skin and tissue, how deep the melanoma has grown into the tissue beneath the skin, the position of the melanoma on your body, whether the surgery will affect your movement afterwards, for example, if the melanoma is close to a joint. The National Institute for Health and Care Excellence, NICE, recommend that for Stage 0 melanoma, melanoma in situ, your doctor removes at least 0.5 centimeters of tissue around the melanoma. Stage 1 melanoma, the surgeon removes at least 1 centimeter of tissue around the melanoma. Stage 2 melanoma, the surgeon removes at least 2 centimeters of tissue around the melanoma. What happens? Generally, this is a small operation. You usually have it as an outpatient, under local anesthetic. This means you're awake for the operation but have an injection to numb the area. The doctor will put in stitches or clips to close up the area where they remove the tissue. This can feel a little tight at first, but as it heals, the surrounding skin stretches and the tightness should ease. You might need to be asleep for the operation, have a general anesthetic, if the doctor needs to. Check your lymph nodes, sentinel node biopsy. Remove a large area of skin or repair it with a skin graft or skin flap. Find out about having a sentinel lymph node biopsy. Skin graft and skin flap. You might have a skin graft or flap to cover the wound if your doctor needs to remove a large area of skin. Most people who have a wide local excision don't need a skin graft or flap. The area can heal up well without one. Skin graft. For a skin graft, your surgeon removes a thin sheet of skin from somewhere else on your body, the donor site. They then place it over the area where the melanoma was. The donor skin is usually taken from somewhere where it won't be too obvious, such as your inner thigh or behind your ear. At first, the area looks like a graze. It may feel quite sensitive or painful at first. The skin grows back quite quickly, usually over a couple of weeks. The skin graft is very delicate while it heals. It's vital that the graft is not damaged during this time. Try not to knock it. You might have antibiotics to help prevent an infection. Skin flap. For a skin flap, your surgeon takes some skin with its own blood supply from an area next to where the melanoma was. There are different types of skin flaps, and sometimes you may need more than one operation for the type of skin flap you're having. Your surgeon explains what you need before you have the operation. Skin flaps are often used for the face. Your surgeon will do their best to make sure the cuts, incisions, they make during the operation fit in with the natural lines of your face so that any scars are hidden. Surgery to remove lymph nodes. If you have swollen lymph nodes near to the melanoma that your doctor can feel, you usually have an ultrasound scan and biopsy. Your doctor takes a sample from the nodes using a fine needle aspiration open a glossary item, or a core needle biopsy open a glossary itemy to check for cancer cells. You might have surgery to remove the lymph nodes in the area if cancer has spread there. This is a lymph node dissection. Go to information about surgery to remove lymph nodes. After your surgery, you can usually go home the same day as your surgery. You have a dressing over your wound to protect it. This is usually kept in place for a day or more. If you have had a lymph node dissection open a glossary item, you may have a drain that you can take home. Your surgeon may use dissolvable stitches to close the wound, which they don't need to remove. For other types like stitches or clips, you need to go back to the hospital 5 to 14 days after your surgery so the nurse can take them out. They will also check how your wound is healing. If you've had a local anesthetic to part of your face, having a local anesthetic to the middle or lower part of your face means that you won't be able to feel anything until it has worn off. So you should avoid hot food and drink until the sensation has returned, as there is a risk of burns. If you've had a general anesthetic, you first go to the recovery area after having an operation under general anesthetic. A nurse regularly checks you. They offer you a snack and drink when you are more awake. You might be in the recovery area for a couple of hours. When the anesthetic has worn off and you feel well, you can go home. This might be on the evening of the operation or the next day. After a general anesthetic, you'll need a friend or relative to take you home and stay with you overnight. Also, for 24 hours after the general anesthetic, you shouldn't drive, drink alcohol, operate heavy machinery, sign any legally binding documents. Problems after a wide local excision. As with any operation, there is a risk of complications. Before offering you surgery, your doctor makes sure the benefits of having the operation outweighs any possible risks. Your doctor or nurse will let you know what to look out for after your surgery and who to contact if you have any problems. These might include pain. You might have some mild pain at the wound site, or at the site you had the skin graft. Simple pain relief like paracetamol can help. If it's not helping, contact your doctor to get stronger pain relief. Infection. Some people get an infection after their operation. Contact your GP or the department where you had the surgery if your wound looks red, is very sore and getting more painful, has fluid discharge leaking from it. You may need treatment such as antibiotics. Numbness. You may have some numbness, tingling, and pain in the area. This is due to nerve injury and may get better with time. Talk to your doctor or specialist nurse if this is troubling you. Bruising and swelling. You might have some bruising and swelling around the area of your operation. This goes down over time as the wound heals. Contact your doctor or nurse if the swelling gets worse. Bleeding. You might have a small amount of bleeding after surgery. If your wound continues to bleed or gets worse, contact the department where you had surgery or go to your local accident and emergency (A&E) department. Avoid strenuous exercise or activity after surgery to reduce the risk of bleeding. Your doctor or nurse will tell you how long for. Scarring. You'll have a scar. The size and shape of your scar will depend on how big the melanoma was and if you needed a skin graft or flap. Scars are quite noticeable and red to start with, but they get paler and less noticeable over time. Some scars can be quite thick and raised, hypertrophic or keloid. Talk to your doctor about any worries you might have about your scar. Radiotherapy treatment. External radiotherapy uses high-energy waves similar to X-rays to destroy cancer cells. You have radiotherapy in a hospital radiotherapy department. You go to the radiotherapy department from your ward if you're already in hospital. Why do you have radiotherapy? Radiotherapy treatment for melanoma is sometimes used to shrink advanced melanoma, help to control or relieve symptoms. Radiotherapy can cause side effects. It doesn't change the risk of the melanoma spreading to other parts of the body, such as the organs. Your doctor weighs up the benefits of giving radiotherapy against the side effects. They will discuss all the possible risks and benefits with you. How you have radiotherapy. You have radiotherapy treatment in the hospital radiotherapy department. For advanced melanoma, you might have a single treatment or a few treatments. Radiotherapy treatment usually happens between Monday to Friday, with a rest over the weekend. The amount of treatment you have depends on whether you are also having other types of cancer treatment. The part of the body getting treated. Why you are having the radiotherapy. The radiotherapy room. Radiotherapy machines are very big and could make you feel nervous when you see them for the first time. The machine might be fixed in one position or able to rotate around your body to give treatment from different directions. The machine doesn't touch you at any point. Before your first treatment, your therapy radiographers open a glossary item will explain what you will see and hear. In some departments, the treatment rooms have docks for you to plug in music players. So, you can listen to your own music while you have treatment. During the treatment, you need to lie very still. Your radiographers might take images, X-rays, or scans before your treatment to make sure that you're in the right position. The machine makes whirring and beeping sounds. You won't feel anything when you have the treatment. Your radiographers can see and hear you on a CCTV screen in the next room. They can talk to you over an intercom and might ask you to hold your breath or take shallow breaths at times. You can also talk to them through the intercom or raise your hand if you need to stop or if you're uncomfortable. You won't be radioactive. This type of radiotherapy won't make you radioactive. It's safe to be around other people, including pregnant women and children. Traveling to radiotherapy appointments. You might have to travel a long way each day for your radiotherapy. This depends on where your nearest cancer center is. This can make you very tired, especially if you have side effects from the treatment. You can ask the therapy radiographers open a glossary item for an appointment time to suit you. They will do their best, but some departments might be very busy. Some radiotherapy departments are open from 7 a.m. till 9 p.m. Car parking can be difficult at hospitals. Ask the radiotherapy staff if you are able to get free parking or discounted parking. They may be able to give you tips on free places to park nearby. The radiotherapy staff may be able to arrange transport if you have no other way to get to the hospital. It is only for people who would struggle to use public transport and have no access to a car. Some people are able to claim back a refund for healthcare travel costs. This is based on the type of appointment and whether you claim certain benefits. Ask the radiotherapy staff for more information about this. Some hospitals have their own drivers and local charities might offer hospital transport. So do ask if any help is available in your area. Side effects. The side effects of radiotherapy for melanoma vary depending on which part of your body is treated. Radiotherapy just to the skin does not have very many side effects. The skin may become slightly red and sore during the treatment period, like a mild to moderate sunburn. This begins to disappear a week or two after the treatment is over. You might have some hair loss if you have radiotherapy to a part of the body which has hair. The hair will start to grow back some time after treatment has finished. But the regrowth may be patchy. General radiotherapy side effects. Radiotherapy can cause many different side effects, such as tiredness. The side effects you get will depend on the area that you're having treatment to. But there are some general side effects that you might experience regardless of where your cancer is. About radiotherapy side effects. Radiotherapy uses radiation to treat cancer. Modern radiotherapy techniques mean that your team can target a very precise area containing the cancer. They also try to plan your treatment so that it causes as few side effects as possible. But any healthy cells in the treatment field are also affected, and this causes side effects. While radiation kills the cancer cells, the normal cells are usually able to recover. And your side effects generally get better over a few weeks. Finding out about side effects. Before you start treatment, your doctor will explain any possible side effects of the treatment. Knowing about the side effects can help you to prepare and manage any problems. Ask about any possible long-term side effects that the treatment may cause or anything else you might be worried about. Side effects during treatment. Radiotherapy affects people in different ways, so it's difficult to predict exactly what side effects you will have and how bad they might be. Some people only have mild side effects, but for others, the side effects can be more severe. Some general side effects include tiredness and weakness. You might feel tired or lack energy when you're having radiotherapy. This may last for a few weeks after the treatment ends. This can be because your body is repairing damage to healthy cells. You have low levels of red blood cells, anemia. You're traveling to the radiotherapy department each day. Some people do keep working during treatment. Whether you can or not depends on how you feel. Rest if you need to and try to exercise when you can. This can help to reduce tiredness. Sore skin. Some people get sore skin in the treatment area from radiotherapy. Your skin might look red or darker. Become more sensitive. Be dry and itchy. Break and blister. The staff in the radiotherapy department can advise you on the best way of coping with this. They usually advise that you continue to use your normal moisturizer unless this begins to irritate your skin. Or use a simple non-fragranced moisturizer and to be gentle with the area. Continue to protect the treated area from the sun for at least 1 year after you have finished treatment. Your skin will be more sensitive, so use sunscreen with SPF 50, sun protection factor 50. Ask your radiographer if you have any concerns. Loss of hair in the treatment area. Radiotherapy makes the hair fall out in the treatment area. It won't cause hair to fall out in other parts of your body. Your hair might grow back a few weeks after treatment ends. If it's unlikely to, your doctor should tell you this before you start treatment. Other side effects. Other side effects that you may have depend on the area of the body being treated. Tell your doctor, nurse, or radiographer about any side effects. They can help you find ways of reducing the effects and coping with them. Possible long-term side effects. For many people, the side effects of radiotherapy wear off within a few weeks of the treatment ending. But for some people, radiotherapy can cause long-term side effects. The possibility of long-term side effects depends on the type of cancer, its size, and position. It might also depend on how close the cancer is to nerves or other important organs or tissues. It is important to ask your doctor, specialist nurse, or radiographer about the possibility of long-term side effects. Depending on the position of the cancer, the possible long-term effects might include a change in skin color in the treatment area, red spidery marks on your skin, telangiectasia, caused by broken blood vessels, a dry mouth, breathing problems, loss of ability to become pregnant or father a child, infertility, low sex drive, erection problems, impotence, soreness and pain, bowel changes, bladder inflammation. Drainage channels to the arms or legs can become partly blocked, resulting in swelling called lymphedema. Radiotherapy effects on your blood. Radiotherapy sometimes slows down the cells in the bone marrow that make your blood cells. This is more likely if you're having treatment to a large area of your body, or having treatment to your leg bones, chest, tummy, abdomen, pelvis. Having chemotherapy with radiotherapy can make the effects on the bone marrow worse. You have blood tests before your chemotherapy to check your blood count. Find out what chemotherapy is. Effects of low blood cell levels. Tiredness and feeling short of breath. You can feel tired and breathless if your level of red blood cells is low, anemia. You might need a blood transfusion to boost your red blood cell count. Or your doctor may suggest that you have hormone injections, erythropoietin injections. The injections encourage the body to make red blood cells. Higher risk of infection. You could be more at risk of getting infections if your white blood cell count falls very low. This is called neutropenia. You might need a short rest from treatment so that your blood count can go back to normal. Chemotherapy can also affect the number of white blood cells. So having chemotherapy and radiotherapy together can make this worse. Total body irradiation, TBI. You have total body irradiation, TBI, before a stem cell or bone marrow transplant. TBI can affect your red and white blood cells. It can also affect your platelet count. Platelets clot the blood, and if they are low, you might be at risk of bruising and bleeding. Because of this, you have regular blood tests during your treatment to check that you have enough red and white blood cells and platelets. Find out more about total body irradiation, TBI. Eating and drinking. Go to the cancer types section for information about treatment for your type of cancer. Your radiographer, doctor, or nurse can advise you on how to eat well. They can also arrange for you to see a dietitian if you are having problems with eating. You usually see a dietitian weekly if you're having head and neck radiotherapy. It is important not to diet during radiotherapy so that you don't lose weight. Your radiotherapy plan is specific to your size and shape. If your weight changes a lot, your radiotherapy plan may need to be planned again. Find out about radiotherapy planning. If you're struggling to eat your usual foods, you can try high-energy and high-protein foods. These include meat, fish, eggs, cheese, full-fat milk, pulses, peas and beans. If you don't have much appetite, you can add extra energy and protein to your diet without actually having to eat more food. You can have high-energy drinks such as milkshakes or soups. And you can add high-protein powders to your normal food. Your doctor or nurse can prescribe these for you. It is important to drink plenty of fluids, at least 2 liters a day if possible. Tips for eating well. You could try some of the following tips if you are having trouble eating. Have small snacks through the day rather than large meals, eat little and often. Have a soft or liquid diet if swallowing is difficult. Avoid alcohol, it can make a sore mouth or sensitive digestion worse. Avoid spicy foods if your mouth or throat are sore. Ask your radiotherapy team about potential problems and how to try to prevent them. before you start your treatment if possible. Tell your radiotherapy team about any problems you have with eating or drinking. They can arrange for you to talk to a dietitian. Ask your radiotherapy team or dietitian if you need any food supplements. Avoid foods that make you gassy or constipated if you're having pelvic radiotherapy. What to do if you have problems. Focus on eating high-fat foods if you are having difficulty eating enough. There are more calories in fat than in protein or carbohydrate. Remember that you might lose a little weight during radiotherapy. But if you are having any problems with eating, tell the team involved in your treatment. If you are having radiotherapy to the head or neck, you may need a tube into your stomach to have liquid food for a time. Read about tube feeding. Alcohol during radiotherapy. Usually it is fine to have small or moderate amounts of alcohol during your treatment. But alcohol can inflame a sore mouth or throat if you are having radiotherapy to your head or neck area. It can also irritate your bladder if you are having pelvic radiotherapy. Radiotherapy can make you feel tired and alcohol can make this worse. It is important not to drive or operate machinery if you feel tired or dizzy. Ask your doctor or radiographer if you are not sure whether you can drink alcohol. Tiredness. You might feel tired during your radiotherapy treatment. This could be because of having cancer. Your body is using energy to repair damage to healthy cells from the radiation. You're in pain. You're having to travel quite a way for your radiotherapy appointments. You're feeling anxious and stressed. This might affect the quality of your sleep at night. Radiotherapy side effects tend to get worse as you progress through your treatment. So you might not feel tired at the beginning of your course, but might do towards the end and for a few weeks afterwards. It's impossible to predict who will feel tired during treatment, some do and others don't. Tips for boosting or saving energy. Taking shortcuts on some things or getting help from other people can help you to feel less tired. Some research into treating tiredness, fatigue, shows that it is important to balance exercise with resting. The amount you do depends on how much you're used to exercising. Pick the time of day when you are feeling least tired. If you're feeling very tired, there are some things you can do to help depending on your circumstances. Drink plenty of water. Eat a balanced diet. Have short naps if you need to. If you're working, see if you can reduce your hours or work from home if possible. Ask family and friends for help with things like shopping, housework, gardening, and collecting the children from school. Don't forget to do things that you enjoy. This may take your mind off things a bit and make you feel more relaxed. Speak to an occupational therapist or social worker if you have problems with your mobility. Write a list of shopping and go when the supermarket is not busy or have food delivered. Do household tasks sitting down, where possible. Play games that you can do sitting or lying down, if you have children. For example, board games, reading books, and drawing pictures. Tiredness after brain radiotherapy. People having radiotherapy for brain tumors often feel tired. This can be worse if you're also taking steroids. The tiredness often reaches its maximum 1 to 2 weeks after the end of treatment. A small number of people are asleep for a lot of the day after a long course of radiotherapy to the brain. This called somnolence syndrome. Radiotherapy can make your skin sore in the treatment area. Some people have no skin problems at all, but others have very sore skin. This depends on the type of radiotherapy you have, your skin, the treatment area. A skin reaction can make your skin red or darker in darker-skinned people. It can also be sore, itchy, look like sunburn, and it might peel and blister. Skin reactions don't develop straight away but gradually throughout your course of radiotherapy. Your radiographer looks out for these reactions. But you should also let them know if you feel any soreness. Skin reactions usually settle down 2 to 4 weeks after your treatment ends. You might also get redness or darkening on the other side of your body to the treatment area. For example, you may have skin changes on your back if you have treatment to the front of your chest. This is because the skin can also be affected in the area where the radiotherapy beam leaves the body, the radiotherapy exit site. Tell your radiographer if this happens. Rarely your doctor might delay or stop treatment if your skin gets very sore. Treatment area. Radiation to certain parts of the body is more likely to cause a skin reaction than others. For example, areas where skin rubs against skin, such as under the breast. Also, areas that receive a high radiation dose, such as some types of head and neck cancer, can cause the skin to become quite sore. As with all side effects, this does vary from person to person. Skin care during radiotherapy. Advice about skin care varies from one hospital to another. It is best to follow the instructions of your radiographers and doctor. The advice applies only to the treatment or exit site area. You can treat the rest of your skin normally. Don't use talcum powder because this can contain tiny metal particles that can make the soreness worse after radiotherapy. Your radiographers or nurses might put on special dressings after your treatment if the cancer is affecting your skin. Don't use sticky, adhesive, tape or dressings in the treatment area. Other skin care tips when washing and shaving in the treatment area include: don't rub the area too hard because this makes it sore. Don't use perfume on the area as this can irritate the skin. Continue to use normal deodorant unless this irritates the skin, but stop using it if the skin is broken. Wash your skin gently with soap and water and gently pat dry. Avoid shaving and don't use heat and cooling pads/ice, or wax and creams for hair removal in the treatment area. Men can use an electric trimmer instead of shaving. Don't use dressings on the treatment area unless your specialist or radiographer has told you to. Wash your hair gently with your usual shampoo if your scalp is in the treatment area, but don't dry it with a hairdryer. Use your usual moisturizer unless this irritates your skin. Clothing during radiotherapy. During radiotherapy and for a while afterwards your skin might be sensitive. The following tips might help. Wear loose-fitting clothes. Use clothes made of natural fibers. Avoid tight collars and ties if you've had radiotherapy to your neck. Avoid shoulder and bra straps, go without a bra, wear a crop top instead, or try a cotton bra. The skin in the treatment area is sensitive, so try to avoid cold winds and strong sunshine. Protect the area from direct sunlight and use a high SPF sunscreen or sunblock. If you're having radiotherapy to the head or neck, you can try wearing a hat or a dense weave silk or cotton scarf when you go outside. You can also try putting up the collar on your shirt or jacket. Continue to protect the treated area from the sun for at least 1 year after you have finished treatment. Your skin will be more sensitive. Use sunscreen with SPF 50, sun protection factor 50. Swimming. Chlorinated water might cause irritation in the treatment area. If your skin is not blistered or peeling, you may go swimming. It is best to shower immediately afterwards to wash off the chlorine and then apply moisturizer. You must stop swimming if it irritates your skin. If you have a bad skin reaction with broken skin, you shouldn't swim until it is healed. Some doctors prefer you not to swim until your treatment is finished. Ask your radiographers for advice if you are unsure. Long-term side effects. You might find that the treatment area is permanently darker after your treatment has finished. This is a long-term side effect, but won't harm you. Later, you may appear to have very tiny broken veins in the treated area. This is also a long-term side effect of radiotherapy. It is called telangiectasia. Tiny veins widen in the treatment area and may show on the surface of your skin. Your GP can prescribe camouflage makeup. There are different colors for all skin tones. Some clinical nurse specialists can show you how to apply it. Your consultant or GP can refer you to the skin camouflage service run by changing faces. This free service teaches you how to apply the makeup and creams and advises you on the best products to buy. Women's sex life and fertility. Radiotherapy to your lower tummy, abdomen, or pelvis can affect your fertility and sex life. Fertility. The ovaries are in the lower part of your abdomen, in the area between your hips, the pelvis. Radiotherapy to this area may affect your womb and can stop your ovaries from working. If you haven't already been through the menopause, this means your periods stop and you won't be able to become pregnant, you become infertile. The risk of infertility depends on the dose of radiation to your ovaries, your age. The risk is higher the older you are, and if you have chemotherapy with the radiotherapy. Finding out that treatment for your cancer may leave you infertile can be extremely distressing if you had hoped to get pregnant in the future. Your doctor and nurse will support you and talk about possible options. It is sometimes possible to move the ovaries out of the treatment area before radiotherapy begins. This is called ovarian transposition. It is usually done by keyhole, laparoscopic surgery. Ovarian transposition may prevent an early menopause. You can see a fertility specialist before you start cancer treatment. They can talk to you about the possibility of freezing your eggs, embryos, or ovarian tissue. You could possibly use your eggs in the future if you wanted to try to have a child through a surrogate. Another woman carries the developing baby. Menopausal effects. Symptoms of the menopause often start during your course of radiotherapy or shortly afterwards. Symptoms include hot flushes and sweats, dry skin, dryness in the vagina, loss of energy, irregular or no periods, less interest in sex, mood changes or feeling very sad. Find out more about early menopause. There are some things that can help to relieve menopausal symptoms. These include hormone replacement therapy, HRT, replaces hormones that are at lower levels due to menopause. Hormone cream, estrogen vaginal cream, can help with vaginal dryness. Going into early menopause can be very upsetting. It can help to talk over your fears and worries with your partner or a friend. Try to talk to your radiotherapy team or specialist nurse if you are having problems. The Cancer Research UK nurses can give information and support. You can contact them on 0808 800 4040 from 9 a.m. to 5 p.m. Monday to Friday. Some of the women's organizations on our general organizations list can also give help and support. Go to the support organizations list. Your sex life. Pelvic radiotherapy can make the tissues in your vagina less stretchy. This is called fibrosis. Fibrosis can narrow the vagina, making it uncomfortable and difficult to have sex and vaginal examinations in the future. Using vaginal dilators after treatment might help to prevent this. The advice to start using dilators varies depending on the radiotherapy center. Ask your radiographer, doctor, or nurse about dilators. Using dilators. Dilators are smooth tube-shaped objects with a rounded end, made of plastic or metal. They come in different sizes. You start with the smallest size first. Photograph of a dilator. For the first 6 months, use dilators with a water-soluble lubricating gel at least twice a week and up to twice a day, for 3 to 10 minutes each time. Between 6 and 12 months. Use dilators once a week. After 12 months. Use your dilators occasionally as long as you are not having any difficulty. Alternatives to vaginal dilators. Sexual intercourse also helps to keep the vagina open and is a good alternative to using dilators. You might prefer to use your fingers or a vibrator to help stretch your vagina. If water-soluble lubricants do not give enough lubrication for comfortable intercourse, you may want to try a silicone-based lubricant. These give more lubrication and are usually fine to use after any vaginal irritation caused by radiotherapy has settled down. A small amount of bleeding is usual when you first start using a dilator, but contact a health professional if you have a lot of bleeding or pain. Men's sex life and fertility. It is common for men having radiotherapy to have some problems with sex. You might have some of the following issues. Loss of interest in sex. You might lose interest in sex because you're worried about your illness or the future. Or it may be because the treatment makes you tired or due to medication you've been prescribed. This might take some time to recover from when the treatment has ended. Sharp pain when you ejaculate. Having a sharp pain when you ejaculate can be a side effect of radiotherapy to the abdomen or pelvis. This is because the radiotherapy can irritate the tube that goes through the penis from the bladder, the urethra. The pain should ease off a few weeks after the treatment ends. Erection problems. Radiotherapy to your pelvic area can cause erection problems by affecting the nerves in that area. The problems might be short-term or permanent. Some medicines or medical devices can help you to get an erection if you have problems after radiotherapy. Talk to your clinical team if you have any erection problems that concern you. Find out about treatments for erection problems. Sex and radiotherapy. It's fine to have sex if you're having internal or external pelvic radiotherapy. But you or your partner should use contraception during treatment and for some time afterwards. Your doctor will explain this to you before you start treatment. This is because sperm made during and after treatment might still be fertile but could be damaged. This could cause abnormalities in a child conceived soon after pelvic radiotherapy. It's important to use condoms if you've had a type of internal radiotherapy that involves radioactive seeds being inserted into the prostate permanently. You need to use condoms even if you or your partner is using another form of contraception. This is in case the seed becomes loose and comes out in your semen. Your doctor will advise you how long you need to use condoms for. Read more about permanent radioactive seeds for prostate cancer. Your fertility after radiotherapy. Radiotherapy to your lower tummy area, abdomen, or pelvis can affect your fertility. This can be temporary or permanent and means you might not be able to father a child in the future. Before you have radiotherapy, a member of the healthcare team discusses this risk with you. They will ask you to sign a form saying that you agree to have the treatment and understand the risks. This can be a very upsetting time, especially if you are planning to have children in the future. Talk to your specialist about the possibility of losing your fertility. They can talk to you about the possibility of storing your sperm banking. Ask your partner to join in the discussion if you have one. It gives you both a chance to talk about your fears and worries. Sperm banking. Sperm banking is the name for the collection and storage of semen. Semen is the fluid that contains sperm. Sperm banking is also known as sperm cryopreservation or semen storage. Collecting sperm before treatment means you might still be able to have children in the future if you want to. The sperm is frozen and stored until you decide you want to use it to have a baby. In some areas of the UK, sperm banking is available free on the NHS. In other areas, you have to pay for it. The National Institute for Health and Care Excellence, NICE, recommend that sperm storage is available to men who might become infertile because of cancer treatment. But each area can choose whether they store sperm for free or whether you need to pay. It is important to talk to your doctor about the risk of infertility before starting radiotherapy treatment so that you can make decisions about whether to use a sperm bank. Read more about collecting and storing sperm. Talking about difficulties. It helps to talk openly with your partner about your problems. You can also ask your radiotherapy team about any problems you have. Although you might feel embarrassed to talk about such personal issues, the team are used to discussing them. They can help you find ways of coping and can refer you to specialists in sexual problems if needed. Emotional effects. It is normal to feel tired and upset at some points during radiotherapy. Or you might feel anxious. Many people having radiotherapy share these feelings. You might feel low or depressed a couple of weeks after your treatment has finished. This can be because your side effects, including tiredness, might be at their worst. It can also be difficult to adjust to not seeing healthcare professionals every day and waiting for your follow-up. This can make you feel isolated. But remember that you can still contact the radiotherapy department or your specialist nurse if you have any problems. General cancer organizations. Where to get help. We all have our own ways of managing difficulties. Some people have a close network of family and friends to support them. Others would rather get help from people who aren't involved in their illness. There is help available if you need it. You can ask at your treatment hospital about the help in your area. There might be local support groups for people having treatment for the same type of cancer. The hospital may provide counseling or your GP can refer you to a local counselor. Find a counselor. Find local cancer information and support. The NHS website helps you to find local cancer information and support in England. About targeted cancer drugs and immunotherapy. Targeted cancer drugs work by targeting the differences in cancer cells that help them to grow and survive. Other drugs help the immune system to attack the cancer. They are called immunotherapies. Find out more about the immune system. When you might have targeted cancer drugs or immunotherapy. You might have targeted cancer drugs or immunotherapy for some stage 3 melanomas to help reduce the risk of the cancer coming back. Stage 3 generally means that the melanoma has only spread to the nearby lymph nodes or to an area between the primary melanoma and the nearby lymph nodes. You might have targeted cancer drugs or immunotherapy. If melanoma cells are found in your lymph nodes after a sentinel lymph node biopsy. After surgery to remove your lymph nodes or in-transit metastases. In-transit metastases are areas of cancer that have spread more than 2 centimeters from where the melanoma started but not as far as the nearby lymph nodes. Or you might have targeted cancer drugs or immunotherapy for melanoma that can't be removed with surgery, it is unresectable. Or if it has spread to another part of the body, stage 4 melanoma. Find out more about the stages of melanoma. Genetic testing of your melanoma. If you are diagnosed with stage 3 or 4 melanoma, your doctor sends a sample of the melanoma for genetic testing. This is to look for changes, mutations, in genes, including the BRAF gene. This genetic change makes the melanoma cells produce too much BRAF protein, which can make melanoma cells grow. About 40 to 50 out of every 100 people with skin melanoma, 40 to 50%, have a change in the BRAF gene. If you have changes in the BRAF gene, doctors describe your melanoma as BRAF positive. If you don't have changes, then your melanoma is BRAF negative. Knowing this can help your doctor make decisions about whether it would be helpful to give you targeted cancer drugs. Targeted cancer drugs. Some of the targeted cancer drugs for BRAF-positive melanoma work by blocking the BRAF protein. They are called BRAF inhibitors. They can slow or stop the growth of the cancer. Some of the BRAF inhibitors include Vemurafenib, Zelboraf, Dabrafenib, Tafinlar, Encorafenib, Braftovi. The BRAF protein can affect other proteins such as MEK, which makes cancer cells divide and grow in an uncontrolled way. MEK inhibitors are another type of targeted cancer drug. They work by blocking the MEK protein, which slows down the growth of cancer cells. 2 MEK inhibitors for melanoma are Trametinib, Mekinist, Binimetinib, Mektovi. You usually have a BRAF inhibitor with a MEK inhibitor, as having the combination of drugs can work better. The usual combinations for melanoma include dabrafenib with trametinib, encorafenib and binimetinib. You take these drugs as tablets or capsules. Find out more about these targeted cancer drugs. Drugs that help the body's immune system, immunotherapy. Immunotherapy helps the body's natural defense system, immune system, to find and destroy melanoma cells. You have immunotherapy if your melanoma is BRAF negative. If your melanoma is BRAF positive, you may have targeted cancer drugs or immunotherapy. The immunotherapy drugs for melanoma are ipilimumab, pembrolizumab, nivolumab. You might have a combination of drugs such as nivolumab and ipilimumab. You have these drugs through a drip into your bloodstream. Other types of immunotherapy. Doctors might use another type of immunotherapy called talimogene laherparepvec, TVEC, which they inject directly into the melanoma. It's a weakened form of the cold sore virus. The changed virus grows in the cancer cells and destroys them. It also works by helping the immune system to recognize and attack cancer cells. You might have TVEC for melanoma that can't be removed with surgery or has spread to certain areas of the body, such as the lymph nodes or skin. It treats the tumor it is injected into, but may also have an effect on tumors nearby. Doctors used to use two other types of immunotherapy drugs, called interferon and interleukin-2, to treat melanoma. They don't use these drugs very often anymore. Find out about immunotherapy drugs for melanoma and their side effects. Side effects. Side effects depend on the type of drug you are having. Some of the common side effects include flu-like symptoms, including a high temperature, sore throat, shivering, and muscle aches. High blood pressure. Headaches and dizziness. Bleeding. Tummy pain. Diarrhea and constipation. Feeling or being sick. Skin problems such as a rash. Tiredness, fatigue. TVEC. Having TVEC may cause some of the common side effects listed above, but it can also cause a reaction at the injection site. This can make the area painful, red, bleed, swell, and feel warm. It can also cause a discharge or leakage of fluid from the site. Find out more about having TVEC. Immunotherapy drugs may cause inflammation in different parts of the body, which can cause serious side effects. They could happen during treatment, or some months after treatment has finished. In some people, these side effects could be life-threatening. Your doctor, nurse, or pharmacist will give you advice about the drugs you are taking, what to look out for when you are at home, and numbers to call if you have any side effects. Contact your healthcare team or advice line urgently if you think you have any side effects from your immunotherapy treatment. They can advise you and give you medicines to help with some side effects. Clinical trials. Researchers continue to look at new and different combinations of targeted cancer drugs and immunotherapies to treat melanoma. Your doctor might ask you to have treatment as part of a clinical trial.